Going live, Paul, now.
Hi.
I'm admitting everyone in. Let's just wait till they're all in. Okay.
Right. Can they see me?
Okay, we're live on our page.
Okay, so we have 38 in the meeting so far.
Are we going back to viewing people?
So
rather than presentation?
I think you can start, Paul.
Okay, so I can see the presentation and we're ready to start. Yep. Good evening, everybody. Thank you for joining us on such a lovely evening. I am Paul Charney, Chairman of the Zionist Federation UK, and it's a real pleasure having a phenomenal guest here tonight to talk us through his experiences. But before we do so, a little bit of housekeeping. I would request that everybody turn their audio off. Any questions that you might have, please do so via the chat or via Facebook Live. Please remember, any inappropriate questions will be deleted and people will be removed. But I'd like to say, and we are really excited to have Dov Maisel here with us this evening. I'd like to just give a few words, if I may, about Dov. Dov is one of the founders of United Hatzalah, Israel's first nationwide all-volunteer medical emergency organization. He works as Director of Operations in cooperation with the government agencies such as the Israeli Police, the IDF, the Ministry of Health. Dov Maisel has invented what is now Hatzalah's Uber-like GPS-based dispatch system, which locates and sends EMTs closest to any medical emergency. A little bit of background about Dov. Dov served in the army as a medic, Israeli Defense Forces, and has served as a combat paramedic in 4 different wars during his reserve duty, as well as in his normal duty. After his army service, he began working as an EMT dispatcher and ambulance driver for Israel's National Ambulance Service. Dov never forgot how the people around him were completely helpless during all those wars. So Dov dedicated his life to saving people. During the terror wave that hit Israel from 2000 to 2003, Dov personally responded in the field to thousands of terror attacks, as well as managing the EMS response system. During that period, Maisel saw that he lacked important equipment in the field during mass casualty incidents that could have saved lives. This prompted him to invent and develop numerous medical devices, including a pocket BVM airway management device, which is now used in many international armies, including the US military. Dov graduated from several NATO and Red Cross-led international workshops on disaster management, and he went on to lead the United Hatzalah international relief missions in Haiti, Nepal, and most recently in both Houston and Florida, USA, after those devastating hurricanes. Additionally, he managed the United Hatzalah EMS response team in Mumbai immediately after the shocking terror attacks that took place in 2008. Currently, he works as the head of the international operations of United Hatzalah and continues to save lives as a volunteer, as an instructor, and as a mass casualty incident manager. He has received Israel's President's Award for volunteerism and sits on the international editorial board of GEMS magazine, Jerusalem magazine. He lives in Ramleh, Israel, with his wife and children, who share his passion for saving lives and empowering communities. So I would like to, with absolute honor, introduce our speaker for this evening, Dov Maisel. Dov.
So thank you very much for that major build-up. I really hope I don't disappoint now. So I'll just once again say it's my pleasure and honor to be here with you this afternoon. I'm Dov Maisel. I'm co-founder and director of operations for United Hatzalah in Israel. I stand here today with you representing over 6,000 volunteers, amazing people from all the walks of life in Israel that are currently responding in the front line of response to Corona, COVID-19 virus. Here behind me, live, is the Jerusalem headquarters, National Dispatch Center of United Hatzalah, which is coordinating all of these efforts 24/7, 365 days a year.
Thanks.
So I think that when you think about non-for-profits, when you think about emergency response organizations, we're not your typical any of the above. We've risen from a small community movement of volunteers in the Jerusalem neighborhood to a fully, what do you call it? What's the best word for it? From a scrappy startup to globally recognized leader and innovator when it comes to life-saving in Israel, a fully community-based emergency response volunteer organization saving lives every single day. So for those of you who aren't familiar with the Hebrew word, and as some of you may know, Hatzalah means rescue. And we are United Rescue of Israel, United Hatzalah. What are we uniting? Well, if we know what rescue means, what are we uniting? We're uniting all the different walks of life of people in Israel, representing the cross-section of Israeli society, Jews and Arabs, Christians, men, women, secular and Orthodox, all in a non-controversial life-saving mission.
You're on live. You can keep speaking.
So our mission in United Hatzalah is to save lives in under 3 minutes. And in the big cities, we respond in up to 90 seconds. That is well within that time frame that you can actually save someone's life. And today, we respond currently to about 1,800 emergencies every single day. But today, during Corona days, COVID-19 challenge, our mission has become life-threatening and simply dangerous. Whereas in day-to-day missions, we know that when emergency occurs, cardiac arrest, sudden cardiac arrest, trauma, or choking victim, we don't have much time. Ambulances is not what saves lives. People save lives. Help can be the person right next door, across the hall, or down the street. It's the difference between waiting 10 to 25 minutes for an ambulance or 1.5 to 3 minutes from the person right next door who can drop what they're doing and come and save your life. Survival rate, just as published by the American Heart Association, for example, in sudden cardiac arrest, every minute that goes by between the time of the cardiac arrest and the time that they hook the patient up to a defibrillator, every minute that goes by, survival rate drops by 10%, which doesn't leave really much when the ambulances show up after 10 minutes or more. getting the volunteer there within that 90 seconds or 3 minutes can actually give a tremendous outcome. And when we look at what we're doing here today during Corona, and I'll get a little bit into the depth of that soon, is simply a dangerous mission now. Sending our volunteers out to leave with the safety of their homes to go help people in the community that they don't know if they are Corona patients or not, exposing themselves. This has become a very, very challenging mission. And I'll talk a little bit about how we've been dealing with that. So a little bit about our solution in the community is first of all, we've created a network of lifesavers, crowdsourcing life-saving. Over 6,000 volunteers from throughout the communities of Israel using state-of-the-art Uber technology, serving everyone by everyone. It's simply about people helping people, neighbors helping neighbors. And last year alone, we responded to over 600,000 emergencies throughout Israel. So how does the system actually work? Just so we understand what the challenge is, not only in Corona, but what our baseline is. So when you have an emergency in the UK, my guess is you dial, I think, 112 or equivalent of 911 in the US. In Israel, you'll dial 1221 or you'll dial the government ambulance service. And while immediately the information comes into this dispatch center behind us, immediately a few things happen at the same time. The dispatcher will instruct you how to perform life-saving procedures, how to perform CPR, stop the bleed, connect a nearby defibrillator. At the same time, our GPS system, which every volunteer is equipped with, will automatically find, by the Uber's technology, the nearest by responders and dispatch them to the scene. And just as in the video that you saw before of the motorcycle, what we call the ambucycles, the first responders will be able to, even in the most densely populated areas where traffic is the worst, get there within 1.5 minutes to 3 minutes and actually save that person's life. So when the ambulance comes there, there's actually what to save. The patient has been stabilized, treated, and then transported to the hospital. So our impact is vast. We respond, like I said, on average throughout the country to over 1,800 calls a day within under 3 minutes. And in the big cities where traffic is worse, Tel Aviv, Jerusalem, etc., our response time is down to 90 seconds. And 90 seconds from the moment the dispatcher is back here, pick up the phone, to the moment the first responder arrives with the ambucycle or with their bike or whatever it is. We know for a fact every day at least 180 people are lives who are in life-threatening situations, their lives have saved. And that's of 1,800 calls. And during Corona days, we're looking at an increase and well over 2,000 emergencies every day. And since the establishment of the organization back in 2006, we've responded to over 4 million calls. But I think the most staggering figure about that is not the number, is the fact that it's done for free. It's done by the neighbor. It's done by the friend, by the person down the street. It's simply for the good deed, for the mitzvah. It's about, once again, neighbors helping neighbors. And how do we do this? Like I said, we saw the ambucycles, so we activate over 1,000 of these ambucycles. These are these scooters. We activate almost 200 bicycles, e-bikes, ambulances, thousands of defibrillators, rescue boats, and all sorts of different technologies. And the most important asset that we have is the 6,000 volunteers. These are the people that make the difference. And now, not only are we doing this in Israel, but globally, the community-based operation, the concept that leveraging power of community is so significant. Even on a day-to-day basis, even now more than ever during Corona, we can see how important it is getting the community involved in helping provide this first response and many other aspects that I'll talk about shortly. And when we talk about Israeli ingenuity, innovation, etc., so I must say that our approach here is to embrace this innovation. We've been leading this Uber technology since before the days of iPhone, back in 2005, when we started this software based off of your location, off of Nokias, old Nokias that had a GPS component on them. We leverage the ability to harness this power of community, people all around, to connect them in this network of life-saving. So it's all about finding the solutions to the problem. Many technologies and many startups try to invent a device or a service that doesn't really necessarily provide a solution. What we're doing is we're constantly monitoring and trying to figure out the gaps within the system in Israel. And when I talk about the system, I'm talking about the emergency medical services. I'm talking about community. I'm talking about humanitarian issues. We find those gaps and we harness the power of community in order to find the solutions for these things. And now our model is not only ours to keep. It's not rocket science. It's about people, technology, goodwill, and some basic training and equipment. And this community-based model is going globally in the US, in Mexico, Ukraine, and even in the UK. We're already in talks with some leaders in the Manchester City leadership. And just a little bit of the pictures of the different activity throughout the world that we've been conducting, whether in training, in establishing this concept in the communities. Of course, we don't call it United Hatzalah when we're talking about communities that are not Jewish communities because they can't really pronounce the word. So we call it United Rescue. It makes it a little bit more comfortable and understanding the mission. And in United Rescue, we're going globally in all of these countries. So the reason we're all gathered today is actually to speak about the COVID-19 challenge, the coronavirus, and how we are dealing with that here in Israel. So coronavirus has hit the world about 2.5 months ago. In Israel, we started preparing for this and started our internal discussions as the media started coming out and talking about this potential of a epidemic. Back then, nobody was talking about a pandemic. And let's look a little bit at the numbers today. Up to date, these numbers are accurate for about 2 days ago. And the total confirmed cases are around 2.7 million people affected by corona around the world, and almost 200,000 people have lost their lives to corona throughout the world. We all saw how hard countries like Italy and Spain were hit in this challenge, and obviously we see what's going on in the US. And when talking about corona in Israel, I should say honestly that way at the beginning of the process, we understood that something is going to happen here and we need to prepare ourselves. I mean, we're all following the media. We all can see what's happening, and we try to stay ahead of the game as best as we can. Current numbers of COVID-19 in Israel are that as of now, 15,500 people have been tested positive for corona. 9,000 of them are still actively ill. Of them, we have 132 critically ill on ventilators in the hospital. The total death toll in Israel today is 200 people have lost their lives, and 6,600 of them have recovered and are actually assisting in many different ways, such as donating plasma and blood components for those people who are in critical condition. I think that the relatively low numbers that we're looking at statistically per 1 million people are very good for one major reason, is that almost 6 weeks now, the country is more or less on general lockdown. Give or take, it was a gradual process at the beginning, but very early in the game, they understood that the earlier they start closing off and segregating the communities and keeping people at home, this will keep the numbers lower, or flattening the curve, as what people like using the term over the media all the time. There was a very intense process of preparing hospitals for mass amounts of severely ill people from corona, preparing in the big hospital, for example, in Tel HaShomer, they actually facilitated an underground parking lot with 60 ICU beds and ventilators, etc., whatever was needed there in preparation for the worst. But taking these procedures very early in the game changed the outcome in what we're looking at today. And as of today, literally today, they just announced that they're starting gradually to start releasing this general lockdown. And as of this morning, they allowed certain businesses to start opening up under many regulations, rules, social distancing, etc. Of course, face masks and everything. Here, I've got my face mask as well that I took off just specially for you, but we go everywhere with it. And this all brought down the general numbers. So when we talk about United Hatzalah and how we prepared for COVID-19 and this challenge, early in the game, we immediately saw a huge increase of telephone calls pouring into this dispatch center behind us. And our call volume at the beginning rose by 40% from about 1,800 emergencies a day to 2,400. Those were many cases that were corona related, and a lot of them also stress related, as you know, from the periphery of the incidents happening, it affects psychologically the people, and we had a huge influx. Over time, we saw a stabilization of the situation, though the call count was still higher. A couple of weeks ago, we started seeing a reduction as lockdown expanded. We saw actually a reduction on certain calls, for example, car accidents, work-related trauma, things like that, because simply nobody was at work and the roads were empty. So we saw a definite drop of those type of calls, but we did see an increase of calls, for example, respiratory distress, pulmonary issues, and of course, coronavirus-related issues. Another major challenge that we were dealing with was exposure and quarantine. And of course, the imminent danger to the volunteer medics. And on the one hand, volunteers that were threatened by the corona, being threatened and afraid to go out on the calls, on the one hand, with the increasing demand of the emergencies on the other hand. And last but not least was a major issue that we were fronted with, and that was the humanitarian crisis. And I will get to that shortly. So talking about the imminent danger of the volunteers themselves, you can see in these pictures, this is what our volunteers look like on 10% of our call volume. These are personal protective equipment suits, full body suits that the volunteers need to be protected in. And this on the average is about 240 emergencies a day that the volunteers need to gear up. These are calls that either were flagged as suspected corona when being dispatched, and there are those that were not suspected. For instance, you go to a car accident, and then it turns out that it's a corona patient that was supposed to be in quarantine and left his house illegally and was involved in a motor vehicle accident. And then our volunteers immediately need to step back, gear up, and go forward to treat the patient. Additionally, transports of patients to the hospitals and the ambulances required not only personal protective equipment, but post every incident, you need to sterilize the whole ambulance, which is a process that takes, I don't know, about half an hour in the hospital with a type of chlorine that sterilizes the whole ambulance. And the third major issue that we had that related to direct danger for the volunteers is the challenge of the patient transports. For example, because they wanted to keep the hospitals clear of the non-emergent corona patients, they immediately facilitated 15 to 20 hotels, of them the Dan Panorama in Tel Aviv, the Dan Jerusalem, that closed down for operation because there was no tourism. So they turned them, the army, the IDF took them over and turned them into corona hospital hotels for those patients that have only light symptoms, etc. And they had the medical corps of the IDF man these hotels. And then what would happen is when there's a patient in the hospital, he need to be transported from the hospital, if he's not in critical condition, from the hospital to one of these corona hotel facilities. And when I talk about imminent danger, I'll just give you one example. At the beginning of this process, we had one of many calls was a call of a volunteer that was dispatched to a sudden cardiac arrest on a 48-year-old person. And it wasn't suspected as corona at first. And he arrives on the scene, and he wasn't even, we weren't able yet to distribute kits to all of the volunteers. So only cases that were flagged as corona, the volunteers would go out with the equipment. And he got to this call, and by just asking the basic questions of the triage by the patient, he understood that this is a corona patient. And he was torn. Do I start CPR and risk myself, or do I leave and wait for a protected volunteer to come? He made this decision, and he stayed and did CPR. He ended up saving the life of this person, which then weeks later pulled out of it at the hospital. But unfortunately, he was tested positive. He was put in quarantine and then tested positive. Thank God he pulled out. But this was one of many, many incidents that we were challenged with by the volunteers in the field in this situation. We were on a weekly basis, as this was unfolding, there wasn't one set protocol from the government. Okay, this is what we're doing all the way through. Every week by the week, they were releasing new orders, new protocols by the government that we needed to modify to fit the needs of our volunteers. One example is breaking down the volunteer force. We need to make sure that we have continuity of operations throughout the system. So what happens is, one of the biggest threats was people going into quarantine. So if a group of volunteers will go into quarantine, I very quickly will have my full workforce of volunteers in quarantine. So what we did was we divided the 6,000 volunteers in the 350 teams into 3-week groups. And while week number 1 is on call, week number 2 and 3 are out of service in quarantine, making sure that they're not getting infected. So if those volunteers from week number 1 get infected, they go to the end of the line, and we have continuity of operations by those volunteers. Same goes for this dispatch center right behind us. What you see here now is the National Dispatch Center. But what we needed to do very early in the game is divide up the workforce of the dispatcher volunteers here. So what we did was we divided them. One group is over here, another group is in the emergency underground center, and another one is off-site in a total other city. Why? So that one team doesn't meet the other. So if one is infected, he doesn't put the whole team out of service. Another reason is the government here, as you may know or not, has a tracking system used by the security services of where everybody is going. And if you happen to be in the epidemiological track of a confirmed corona patient, you will receive a text message on your phone that you've been identified as on the epidemiological track of a coronavirus patient. You have to go into 14-day quarantine. And what happened was, one of our own staff was tested positive, and actually the whole building, including all of the dispatchers back here, got a text message that they need to go into quarantine, which was the biggest threat for us. We were able to, with our connections in the Ministry of Defense, release all of the volunteers that were not nearby this worker that, thank God, had light symptoms and went into quarantine, and then 2 weeks later tested negative and back to usual. But it proved that the system that we put into place of not having everybody exposed to each other, creating these groups, enabled us to continue operations without any issues. Another thing was, we were overloaded with from different organizations, from the Ministry of Defense, IDF, Home Front Command, social services, municipalities, all started approaching us for different assistance that they needed when it came to the humanitarian issues. And when I talk about the humanitarian issues, I think that is one of the biggest challenges that I think most countries don't even think about, how deep the impact is when you create a lockdown, especially of over 2 million people in the risk group of over the age of 65, where they can't leave their houses on the one hand, and on the other hand, their children or family members cannot come and give them the support for the basic necessities that they need. So what we did was we went out with a huge campaign throughout the country in many different languages, 1221 reaching everyone. 1221 is our emergency hotline. And we went on and opened up a humanitarian dispatch center. This humanitarian dispatch center is manned with another 40 dispatchers focused on simply on humanitarian needs. And what are the humanitarian needs? Humanitarian needs are medication. Imagine you're an elderly person, you need your medication for your diabetes, for your congestive heart failure, for your asthma, for whatever it is. If you're not going to get that, a week later will be dispatched to you in a life-threatening emergency. We're talking about people that couldn't get to their basic shopping, bring food home, get psychological support, basic medical support, help with utilities at home, where on the day-to-day basis, your kids will come over and help you. Here, your kids can't leave home because they're on lockdown and there are barricades on the highway, so they couldn't come by either. So working in collaboration, working in collaboration with Ministry of Defense, IDF Home Front Command, social services, and all the different municipalities throughout the country, we were able to respond to over 100,000 phone calls in the period of the last month. Of them, besides the information provided to them, we executed 26,000 humanitarian missions of medication, food, medical support, psychotrauma. People are lonely at home. They're not getting any visitors. Some of them are Holocaust survivors, etc. So we had our psychotrauma team extensively go out and work with these people in the communities. So just one special story that comes to mind as I start wrapping up is to see the importance of this humanitarian support. Is there was one call in Beersheba, and our paramedic by the name of Ravital it was a call to get this elderly person his medication, and she went to the drugstore and picked up the prescription and came back to the house and started talking to him. She brought in the medication. She helped him take the medication that he needed, and she felt that something was a little bit off. And as she was talking to him, suddenly she sees that he's starting to lose consciousness. So immediately she pulls out her glucometer, checks his sugar level. Turns out he's in diabetic shock. Immediately treats him, starts an IV line, gives him a glucose IV, and saves this man's life. It's all about that person being there. And this was because he waited 3 or 4 days to get his medication. He simply didn't have the medication. And having that volunteer come by, care for him, he could have been found dead 3 days later in his home. But thank God the volunteers were there to do this non-emergent humanitarian mission. So as I come to wrap up, I wanted to show a video of Nas Daily, who's a famous vlogger. But just a second, let me try and get this thing up here. But as I was planning to do that, I'm having here an issue. Just a second. I'm sorry. Let's see over here. Whoops. Yesterday, Nas Daily put out a special message. I was planning to show a video that he showed telling the story of what this organization does. It was viewed by over 50 million people around the world. And yesterday, he came out with this video. That's why I'm even doing it off the Facebook, because I don't even have it direct. But I think it's an important message that will really sum up everything that we're talking about over here.
Dov, thank you. It's unbelievable. The numbers are overwhelming, simply overwhelming. We want to, before we start on our question, just thank you for the huge effort and the lives that you are saving. So I'm going to, without further delay, I'm going to go straight to some of the questions. As you can imagine, people are eager to ask. One of the first questions that came through was a man named Elias Fermon from Mexico, who apparently you trained for Zaka a few years ago. He has a question. He's saying in Mexico, at the Mexican Red Cross, they use quaternary ammonium, UV light and ozone generators to sterilize both personnel and ambulances. Have you had any experience with these products? Do you use anything else other than chlorine?
Sorry, I'm having technical issues here.
No problem. Did you hear the
Just a
question?
second, let me. I'm sorry, something here is technically not working. Can you hear me?
I can hear you, yes.
Okay, let me try this again. Sorry, I apologize.
That's all right.
Okay, I am with you guys.
Okay. Would you like me to repeat the question about the Mexican Red Cross?
Yes, please.
Okay. So this is coming to us from a man that you used to train at Zaca in Mexico, a man named Elias Fermon,
Oh,
who sends his regards. He asked the question that in Mexico they use quaternary ammonium, UV light, and ozone generators to sterilize both personnel and ambulances. Have you had any experience with these products, or do you use anything other than chlorine?
we're working according to the protocol of the Ministry of Health here, and the Ministry of Health here requires very basically the chlorine and a certain titration with sprayers throughout the ambulances. But that's we don't use any. There are also different techniques here that are used with UV and other sorts, but we're just working according to the basic protocol.
Okay, fantastic. I have a question from Emma. With the restrictions being slowly lifted, do you think there is a chance there could be a second wave of coronavirus outbreak? So
I think the simple answer is that the game plan that we're working according to, the war plan, is the simple answer is yes. The simple answer is yes. They are expecting a second outbreak. Not only that, but the whole process of releasing the lockdown is sort of a, for the lack of a better term, I would say like a human experiment to see if society are willing to play along by the rules of social distancing, masks, sanitary issues, etc. And they're monitoring to see what's happening. That said, for example, we know that we have Yom Ha'atzmaut coming up, Independence Day on Wednesday, and yet the country is going to be on total lockdown again because they simply know that if they're going to let everybody loose, immediately you'll have parks full of thousands and thousands of people. So they're going back to general lockdown with hope that once again they'll start releasing afterwards. However, that said, they're also looking at a second wave at a later stage, later in the year, at the end of around fall time, beginning of the winter, where they're expecting a possible second outbreak, in hope that the country is better prepared then than it was now.
Okay, interesting. I have a question for Pippa Ellis. I'm going to vary slightly. The future of your humanitarian service. We know that Hatzalah has been working for many years, but you've been working under different circumstances. Now, how do you see your service changing or continuing in the years to come?
So I think that the very basic thing is, first of all, United Hatzalah is a community-based organization. It's grassroots. It really is about the community. And as all the projects that we have, yes, the heart is emergency service, and you can see that they're doing this here. But we also have many other projects that are working within the community. Like I said in the presentation, we're constantly monitoring the gaps of the special needs that arise from the community. Of course, all related to the medical world, of course. We're not going to start planting trees or doing things like that. But anything that has to do with prevention, with response, with training, with awareness, anything that has to do with that in the community where we see there is a need, our people are there. Let's just remember, it's the people that are right next door. When we're dealing now with the humanitarian issue of the elderly people, these are our grandparents. That's who they are. So of course we have to be right there for them. So also looking into the future is obviously advancing technologically, but continuously working within the community to find the unique needs that need to be and challenges that need to be solved.
Okay, Asafa Demoni asks, do United Hatzalah have all the equipment it needs to function safely during this coronavirus time?
That's an interesting question for a non-for-profit. We're constantly it's a constant challenge throughout regular days, but even more during Corona times, because, like I said, just looking at the demand and the need, we're looking at an increase of 40% on our activity, even 50% with adding the humanitarian issues on our regular annual operation budget. So obviously, it requires us to really be careful with our donor dollars, as we say. But there's a constant challenge. Whether it's protective equipment, whether it's medical equipment, oxygen. We've been on the increase of use of oxygen by almost 50% because of all the airway and breathing and breathing things and breathing calls, emergencies. So it's a constant challenge.
Okay. A very good question from Steve Simbler. Do you have a system of coordination with all the other emergency organizations, and specifically Magen David Adom, so that there is no conflict and no clash?
So there's no conflict, there's no clash, and there's even no overlap. But we did, in the coronavirus, Magen David Adom got the mandate by the Ministry of Health to perform, for example, all the corona testings. For example, the tests of the corona. So we understood that would not be putting our resources in the right place. And what we did was we are doing our basic core operation of first response. Let's remember that Magen David Adom, being the government service, was overloaded significantly, and we saw a decreased response time for the ambulance facilities, and more important for our volunteers in the community to perform that first response until the Magen David Adom ambulance would get there. That's on the one hand. And then on the other hand, bringing this humanitarian relief hotline that, like I said, got over 100,000 phone calls and over 26,000 incidents responded to. That was from a need within the community, understanding that a patient that doesn't get his medication, now it's just a humanitarian mission, but in 4 or 5 days, it's going to turn into a medical emergency. So, like I said, it's constantly trying to find where the need is there. We're not looking to open up more of the same.
Okay. Shai Jesko asks, what's the greatest need that United Hatzalah currently has? And I think it's coming from a place where he'd like to help, and maybe there are other members who are watching at the moment who could try and help. What is your greatest need?
Hi, Shai. Thanks for the question. Yes. So first of all, I'd say personal protective equipment. Though we're slowly releasing the lockdown, the numbers of corona patients is still vast. And we need those protective gear equipment for the ambulances that will continue transporting those corona patients. We're still going to be responding to patients that are diagnosed with corona. Yes, the numbers won't be staggering and doubling and tripling, but still we're talking about thousands of patients out there and potentially infectious patients in the community. So first of all, protecting the volunteers. Like I said, that's the imminent danger. Then we have oxygen, other medical equipment, the regular things. But I would say that would be, if you ask me the one thing, that's the most important one.
Okay. Dalia wants to know if there is any charge if there is a call out for an ambulance.
Absolutely not. Everything, anything and everything that is dispatched out of this room over here is done totally for free. This is simply for the mitzvah, for the good deed. Love your neighbor. Very simple. We don't even have a billing system. It's that good.
That's fantastic. I think you might just increase your call rate now that you did that. Dov, tell us how when you're out on duty, how are you received by citizens of Israel, and how are you perceived? Are they helpful, or do people get in your way?
Well, the biggest problem in Israel, everybody knows best. That's first of all. So that's why coming from the community plays in your favor, because when we're dispatched, and it doesn't matter if I live in Tel Aviv, in Haifa, in Jerusalem, in Umm-el-Fachem, or in Tiberias, it doesn't matter. It's me from the community. So I've been on calls, and you can ask any one of the 6,000 volunteers. They're responding to their neighbors. They know them, they're expecting them, and they're much more compliant to help them. I think that also in Israel as a culture, people don't just stand aside when they see someone on the street. Immediately people come and want to help. So it's more like when the professional volunteer will come from the community, then they'll immediately see what they can do to help him as well. But often you never see a person just lying there in Israel on the ground with people just looking. Somebody is trying to help. Also remember that in Israel, there's mandatory military service. And everyone who goes through the military here, when they're 18, 19, 20, so they do some basic first aid course in the military. So they try to use the basic skills that they've gotten there and, stop the bleed, start CPR until the volunteer will arrive.
Dov, tell us, are there any no-go areas in Israel where either it's not safe or you're not permitted to go into? For example, the territories. Is there anywhere you are not permitted to go?
So the simple answer is we cannot go into Palestinian Authority, but otherwise, West Bank, wherever else, you have volunteers everywhere. We're talking about Judea and Samaria. We're talking about the settlements. We're talking about East Jerusalem, Arabs from East Jerusalem that are volunteering from within the community. We're talking about, I would say that there's no area that there are no-goes for volunteers. I think it's also important to say that even in areas that typically you might say are hostile, the fact that the volunteers are coming from within the community itself, this is not someone coming from the outside to come into the village and help. These are people from the community, from the village. So it's safe for them. And this is like a bridge also to Magen David Adom services when they come into different areas of Palestinian East Jerusalem, etc.
Dov, you guys are working worldwide. Do you train responders from other countries? And if so, which countries do you work in?
So I mentioned during the presentation, we're active in the US and Panama, in different places in Asia. Just last year, I was on a big training tour throughout India and Sri Lanka, where we were training the authorities and the ambulance services of India throughout the major cities there. And in Sri Lanka as well, it incidentally happened that the major terror attack that happened in March of last year in Sri Lanka came 2 months after we were there training all of the authorities there on mass casualty response, terror-related issues, etc. So we try and share the experience that we've accumulated over the years here for those who are interested to hear. And we try to share the concept of understanding that it's not only about the ambulance or the fire engine or the official first responders. We have the first responders. That's the community. The community plays a vital role in emergency response, in day-to-day, and of course, in disaster preparedness.
Dov, tell us, how many hours a day are you and your volunteers working currently?
How many hours a day?
How many hours a day?
I don't know. We started about 15 years ago. We haven't stopped yet. So it's 24/7. People ask, what kind of shift does a volunteer do? We don't have shifts. People are on call 24/7. They go around with this device on their belt, and any incident that happens and is nearby them, they can be in the cinema, they can be in the synagogue, they can be at home, they can be sleeping. If their device goes off, it means that they are within that 5-minute range. They are 5 minutes away from an emergency that they can be the difference between life and death. And then we put them on a guilt trip if they don't go.
That's fantastic. Tell us about the real heroes, your wife and children, the families that have to support you. Tell us a little bit what they have to go through.
You know what it is? It's a family. It's a family effort. I mean, I'm married for 19 years now, and my wife, of all these years, that really suffered from what I was doing, at a certain point, just said, if you can't beat them, join them. So 2 years ago, she did an EMT course and became a medic, and now she runs out on the calls. Wow. So, but yeah, it really is a family commitment. I mean, the organization is a very family-like organization. There's a support system here within the organization for the families of the volunteers, and I think that more than anything, it educates our kids. I have 4 kids, thank God. I have a teenage princess and 3 monsters, and I tell you that this gives them a different skill set for life, to understand that it's not all about your iPhone or your iPad or me. It's knowing that in the worst of times, that call comes in and you go. And I think this really gives them the right values in the right place.
That's fantastic, I have to say. Please send our best to your wife and children. Dov, tell us, no one would like to know what kind of percentage, how many Israeli Arab volunteers you have that you're training and work for you.
So we have about, it's around the 10%, give or take. I think it's a little more, but I would say 10% of the volunteers are Arab, coming from all the different Arab communities throughout the country, from the Galilee and the Druzim in North Golan Heights, and the Arab communities in Al-Fahim, and of course East Jerusalem, Bedouin from the Negev. It really is, and of course the old city of Jerusalem, which you see volunteers in the Jewish quarter and in the Muslim quarter, and everyone together. It really is. It's about, or I think, a little more than the 10%.
That's fantastic, Dov. So you really are bridging the divide as well. And tell us about the Haredi community. Do you work with the Haredi community? Do you have volunteers from them?
Do we work? This organization started in the Haredi community. Back 20 years ago, when we started this as teenagers, we started with a bunch of Haredi volunteers. It started in the ultra-Orthodox neighborhoods in Jerusalem of Beit Vegan and Mea Shearim and others, and it grew out of the Orthodox communities during the Second Lebanese War in 2006, when the organization was established. And when we called it United Hatzalah, one of the purposes of the name United was really to unite all the different walks of life of people in Israel, not just the Orthodox community. This is something that our mission, like I said, is life-saving. But one of the amazing byproducts here is the bridges that are built in the community here, between the Orthodox and the secular, and between the Jewish and the Arab, and so many directions. It started in the Orthodox community, but over 14 years now, it's uniting all the different walks of life of people in Israel.
So Dov, what happens if somebody in the Haredi community falls ill and your GPS system kicks in and the nearest person is a young secular woman who receives the message? What happens?
Same thing that happens if you call the NHS with an ambulance and they come to the scene. It's automatic. It's like the same question. What do you do on Shabbat if a call comes in? You'll see the ultra-Orthodox with his beard down to his knees, jump on the motorcycle and drive away. It's the most natural thing, and it's embraced in the community, and it's appreciated, and that's why it also creates that feeling of connection between the different groups of people in Israel.
Dov, that is fantastic to hear. You really are bridging the divide. Tell us a little about the running costs. Can you give us an idea of the cost of ambulances, motorbikes, equipment, annual expenditure, and where does the funding come from?
So the organization is a non-for-profit that does not get any government funding, none whatsoever. The operational costs are about, you'll do the math for me because I don't know in pounds, but it's about 100 million shekels a year to operate this amazing center and all of the volunteers throughout the country.
Just over 20 million pounds,
around 23 million pounds to activate this amazing organization and the volunteers. Like I said, the service is free. So it really is building the support system for the volunteers, motivating them, getting them the support that they need with the equipment and everything. The ambucycles cost about, I think it's about $36,000. That's about probably 40,000 pounds. A little less there, a little more. A little less than 36,000 pounds for an ambucycle, 150,000 for an ambulance, give or take. And basically everything else that goes around. The technology that we use really takes a lot of funding, but nonetheless, we're actually, the fact that the government doesn't fund us gives us a lot of ability to actually be effective and not drown in bureaucracy. So I think that's one of the most important things.
Well, that would be a first for Israel, I have to say. But Dov, what can I tell you? you guys are not only just bridging the gaps, which maybe I could suggest there is a couple of government parties that might need your help bridging the divide. But besides them, I must say it's the one unifying organization, the one unifying diamond in Israel that I think everyone can agree that we take off our hats, and some of us will keep our hats on and just say, Kol hakavod, well done. Thank you so much for saving lives, for doing your best, for setting the examples, for making Israel the shining example that it needs to be, the light unto nations. You are personifying that. You, your team, your families, and everyone around you. We talk here in the UK, we talk about heroes of the NHS, the National Health System, and we talk about the heroes of the doctors, essentially giving their lives, giving their days, exposing themselves to all manners of potential dangers. And you guys are doing the same. So you really are the heroes of today. You are the Sayeret Matkal of today. I just want to, on behalf of everybody here, because without having to speak to everyone who's heard what you had to say, everyone is dumbfounded, the amounts of lives that you are saving, and everybody together would like to thank you. And anytime you need our help, just call. You know, we're just on the back of a line. I mean, you guys, International Rescue Thunderbirds are go. I think you should rename yourselves. So it is phenomenal. So please come, and when you can see us live, then come and see us. Come and talk to us. People would like to shake your hand. Thank you so much. Thank you for joining us.
Thank you very
Stay
much.
safe, stay healthy, and please God, we come out of this better and healthy.
Amen. 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 Thank you. Thank you. Thank you very much, everyone.
Kol tov. Thank you, Papa.